Hi, I'm Jared Younger. I am director of the Neuroinflammation, Pain, and Fatigue Laboratory at UAB, and this is a series of short videos where I want to talk about the important concepts in the laboratory, discuss the new results that are coming out of our projects, talk about new projects that we're starting, and talk about important news in the field that may be important to you. So I want to start this first video discussing neuroinflammation, and that's because that's the term that we throw about the most and we rarely define it. So I want to make sure that we discuss that at least on a conceptual level very briefly, so you know why we're interested in neuroinflammation and why that may be important if you have pain or fatigue or cognitive issues. So inflammation is something that we're all familiar with. When you have inflammation in your body, for example, if you get a splinter in your thumb and it pushes some bacteria in your thumb, you're going to have an inflammatory response to that. And that basically means it's an immune response that's calling the aspects of the immune system, the immune cells, to that area so they can fight off that infection and repair the damage. So it's a very, very important part of being alive. It's important for our survival. Now, when you have inflammation in your body, you're going to notice a few things. It's going to be red. It'll feel hot. It may be a little swollen. It'll hurt if you touch it. And it'll also interfere with the function of that body part. So again, if you have inflammation in your thumb, it's going to be hard to bend your thumb. If you have inflammation in your knee, it'll be hard to bend your knee. If you have inflammation in your gums may bleed. So inflammation can interfere with that body part where the inflammation exists. Now, transiently, over a short period of time, inflammation is a good thing. Like I said, it repairs damage, it fights off the infection. But if it goes on for months or for years, inflammation becomes a problem because it starts to destroy healthy tissue. So if you have chronic inflammation in your knees, over time that inflammation may start to degrade the quality of your joint, and that will lead to severe problems down the road. If you have inflammation in your heart over too long of a time, that may cause damage to your heart tissue. So without exception, inflammation over a long period of time is a bad thing, and we want to reduce that and stop that inflammation. Now, with neuroinflammation, all we're doing is we're taking that concept and we're moving it into the brain. So the neuro just means neurons, that's the cells of the brain, and we're talking about inflammation. The basic process is the same. The cells are a bit different and some of the signal pathways are different, but it's the same basic idea. It's inflammation that's occurring in the brain. It's still designed to fight off the infection. It's still designed to repair tissue. So if you have the flu, you'll have a neuroinflammatory response. If you are skiing and you hit your head and you have a concussion, you'll have a neuroinflammatory response to repair the damaged tissue. So it's very important. So brain inflammation over a short period of time is a good thing. But just like in the body, if it goes on for too long, it becomes a problem. Now, when you have brain inflammation, you don't experience it the same way as inflammation in your body. You can't see it become red. It won't feel hot because we don't have the ability to feel heat inside our brain. And it won't hurt at the site of inflammation because we don't have pain detectors or nociceptors in the part of the brain. So you can't really feel when you have brain inflammation. But brain inflammation will affect the body part where it exists. But instead of it meaning you can't bend your thumb or you can't bend your knee, now we're talking about the neurons that drive your thinking, your behavior, your mood, how much fatigue you feel, how motivated you feel. Really, every aspect of who you are can now be impacted by inflammation because the inflammation is now affecting neurons. So that can be even more severe of a problem. Now, neuroinflammation can present in a range of different ways, from low-level inflammation, which would be like having a severe case of the flu. You're going to feel fatigued, have pain sensitivity, some cognitive disruption, because that's exactly what's happening when you feel horrible when you have the flu. That's a neuroinflammatory response. And it can range all the way up to severe neurodegenerative disorders like Alzheimer's, where the neuroinflammation is actually damaging healthy neurons. Now, those are different conditions entirely, but they're both driven by neuroinflammation. So that's really the goal of this laboratory. We recognize that chronic brain inflammation is a bad thing, just like chronic inflammation in your body is a bad thing, and we need better treatments to take care of that problem. And we believe that if we can develop these new treatments, we can help people with chronic pain, chronic fatigue, cognitive issues, depression, and a few other conditions as well. So we have two major goals in the laboratory. One is to develop ways to see neuroinflammation in living humans. It's very difficult to do because we can't get through the skull to actually measure the fluids around the brain to look at the chemicals. So we have to come up with neuroimaging and other methods to actually see inflammation in the brain. And the second goal is to develop the treatments that can get through the blood-brain barrier, reach the brain, and reduce that inflammation. And that's also very difficult because most drugs can't get through the blood-brain barrier. So that's what we're working on. That's the major goals of the lab. In subsequent videos, we're going to talk more about those specific projects and give you more information about what we're doing.